Good evening to everyone in the studio and to the people listening on TV. Tonight we're here to have a very informative and powerful discussion. It's about leadership. We'll explore leadership and inclusion. If we look at the theme for it's amplifying the leadership of persons with disabilities for an inclusive, innovative, and sustainable future. So we'll be looking at that. I want to thank SKNAPD for coming on board and sponsoring this program for us. So because without them, we wouldn't be here tonight. I also want to thank ZIZ for having us and the Association of Persons with Disabilities also. So let's get started. We have an hour to do this, so let's get started by asking each of you to introduce yourself, the organization you represent, and your organization's interests as it relates to disability. We'll start at the end there, Darby.
All right. Well, good evening, everyone out there watching today. Good evening to my fellow colleagues as well. My name is Begho. I am the founder and program director at Lake Health and Wellbeing. We are a public health NGO based in St. Kitts, and we aim to improve the health and well-being of our local, regional, and online communities. And we do that in a number of ways, through research, through public health intervention, so that's projects in the community, through advocacy, and through health education. And so we're particularly concerned about issues related to persons with disabilities, because we know that when we think about the theme for today, which is on leadership, we firmly believe that people cannot thrive and get into leadership roles, they can't progress in those roles, and they cannot be successful if they're not healthy. And so we're really concerned about persons with disabilities being able to achieve the best health possible. So that's why we're interested in this topic tonight. So we're looking forward to the conversation, and thank you to the Association of Persons with Disabilities for the invitation to participate.
Hi, good night, everyone. My name is Mrs. Marecia Brown, and I'm the coordinator for Disability Services within the Ministry of Youth Empowerment, Aging, and Disabilities. And well, I'm here for the very obvious. I'm representing the Department of Disability Services, and once ago, we fell under the Ministry of Social Services or Social Development. But last year, in February 2023, the ministry was launched because the government felt that there was a need to prioritize persons with disabilities as well as seniors and youth, three groups that are often marginalized, to give them a little bit more attention. So what we do in our department, we primarily advocate for persons with disabilities, and since we've been active, we've been building our relationship with the different groups and that work with persons with disabilities. And so we are here to, just have a discussion to see what's going on within our department and how best we can continue to help the community in which we serve.
Hi, good day. My name is Crannie, Cranston, and I am a floor member for the St. Kitts Nevis Association of Persons with Disabilities. I am here to represent youth with disabilities to educate the nation about our challenges and goals and to make changes in our nation.
Okay, I guess we'll get started. I'm the PRO for the St. Kitts Nevis Association of Persons with Disabilities, and I've been tasked with hosting this show. So we'll have a lively discussion as we ask certain questions and get the information out there to the people of St. Kitts and Nevis and to the wider Caribbean and to the wider world. Wherever you can find ZIZ on the internet or on the dial, tune in, because it's going to be informative. I'll start by asking Ms. Cranston, as the youngest person on this panel, what are the biggest challenges that young persons living with disabilities face every day? And how do you think society can address these?
Well, I think that some of the biggest challenges are education, healthcare, and accessibility. The reason being, we have education system that does not allow persons living with disabilities to come together in mainstream education like normal persons. Healthcare. I firmly believe that all healthcare institutions should become accessible to wheelchair persons, to persons with disabilities. And we are asking if we want healthcare systems to change, let us help make a change by making the building codes more accessible and changing the building codes. Thank you.
Okay, when you say healthcare institutions, does that include like doctors' offices or just the health centers and the hospital?
Doctor's office, anything that includes healthcare.
Okay. Let me just say, we were supposed to have the president for the Blind Society here tonight, but due to some mix-up, he won't be here. And we were trying to get him patched in on the phone, but ZIZ is currently having some phone issues, so we won't be able to have him on tonight. We apologize for that. So I'll move to Ms. Begho. What unique health challenges do people with living with disabilities face, and how can public health initiatives better address these?
Well, I'm going to start really with some of the challenges that we observe when we're thinking about persons living with disabilities and some of the health challenges that they might encounter. And also feel free, fellow panelists, to jump in if I miss any health challenges. So I'm going to really start with when we think about the health challenges that persons with living with disabilities face, we sort of have to start thinking about what are the health challenges that they have that are associated with their particular disability. So for example, if you have mobility challenges, what are some of the health challenges that you might experience because of that? So you may have muscle weakness, thinner bones, might have stiff joints. And so we want to understand whether you're being catered for and you're able to manage those health conditions. And the same thing might happen, for somebody that might have lost a limb. What are the health challenges associated with having lost that limb? So that's the first health concern that we have when it comes to persons who are living with disabilities. So then apart from that, we know the World Health Organization has said that persons living with disabilities are more likely to develop conditions like diabetes, hypertension, which are non-communicable diseases. So they're twice as likely to develop those conditions. And there are various reasons for that. So we're very concerned about that. One of the reasons why that is because persons living with disabilities might not be able to access health information, they might not be able to access physical activity, they might not be able to access nutritious food for various different reasons. And so that might put them at an increased risk of developing non-communicable diseases. So apart from that, we're also concerned as it relates to that, as I was saying, that there might be issues with accessing things like physical activity. And we know that physical activity is very important in terms of maintaining health. So physical activity and exercise improves heart health and all of that. But obviously, if you have a mobility issue or if you have any type of issue like that, you might not be able to participate in exercise, not because of yourself necessarily, but because things might not be accessible. Gyms might not be accessible, the roads might not be accessible for you in terms of trying to get out there to get active. So also what we're also concerned about, which comes up a lot, is access to health insurance. So we know that persons living with disabilities might struggle to access affordable health insurance for various different reasons. And we're very concerned about that issue because we want to make sure that persons that are living with a disability are able to access health insurance so that they can access affordable health care. Ms. Cranston would have mentioned another issue that we're concerned about, which again is accessibility to healthcare services. So are you able to access the health centers? Are you able to access the doctor's office? Are you able to access the hospital? And that can be different types of access. That can be physically accessing the building, but that can be accessing the information that people present during that, during a consultation. So various different issues around access. So we want to make sure that, as you get into a health center, as you get into the hospital, you're able to navigate your way around, that when you get there, you're treated with respect and dignity, that people are prepared to receive you and treat you well. There are other issues as well that we're concerned about, which would be things around mental health issues and isolation, because navigating this world that has not been set up to accommodate you can also can play a mental toll on you. So again, there might be isolation and mental health issues that we're really concerned about. So I think all of those issues are particular to persons living with disabilities, and so we're quite concerned about them. And there are a number of solutions that we can think about, which we could come to maybe later, because I think I've gone on for a bit too long. But that's just to address the health challenges that persons with disabilities face.
We'll get to some of the issues later on. But I wanted to just ask you one thing quick. What role do you see community outreach, like the people in the community themselves, playing in removing some of those barriers that you spoke about, or increasing access? What role do you see the community itself
The community itself playing?
Yeah.
So I think, it depends on how you're defining the community. So if we're thinking about the community as in the community-based organizations. So community-based organizations, they can help in terms of by providing services and programs, health-related services and programs aimed at persons living with disabilities to improve access. So that could be health education programs, campaigns, developing literature that is easy read literature, different things that can be developed specifically for people living with disabilities. From an individual perspective, there are many things that people individually in the community can do to help persons that are living with disabilities. They can advocate, so they can speak up on behalf of persons living with disabilities to ensure that there are policies and programs specifically that address some of the accessibility issues as it relates to health centers and other particular issues.
Okay, we have to break in a while, so when we get back from the break, we'll hear from the representative of the Department of Disability Services. So we'll break now and we'll be back in a minute and a half, 2 minutes, somewhere around there.
This program is sponsored by SKNAPD.
I am 5'6".
I have natural hair.
I have brown eyes.
I am a Calypsonian.
I am a dancer.
I am a gold medal Special Olympian.
I love all things craft.
I am a graphics designer.
I am a motivational speaker.
But we can't put those skills to work for you
if we are not given the opportunity.
If you don't have an open mind.
If you don't honor workplace diversity.
If you don't hire us.
If you don't realize that we work best together.
Together, we are differently able.
And it's what we can do.
It's what we can do.
It's what we can do that matters.
To support this cause, contact the St. Kitts and Nevis Associations of Persons with Disabilities at 465-2151.
And we're back. We're back and we will continue this discussion with Ms. Brown from the Department of Disability Services. And my question to you is, what policies or programs are currently in place to support leadership opportunities for persons with disabilities?
Okay. So again, thank you for having us. Policies or programs that are currently in place. To answer that, we don't necessarily have specifically any policies or programs of such. But what we're doing and what we've been doing since the department came into play, we've been trying to encourage or trying to have persons with disabilities represented at major discussions. So whenever there's a workshop going on, whether it was or something that's hosted by us or any other ministry, we try to encourage someone with a disability to be represented. And we've noticed, myself and Ms. Douglas, a program officer within our department, we've noticed that other ministries are slowly but surely getting the message, because from time to time we'll hear someone, whether it's, I don't know if Crannie or somebody else will come and say, oh, they were invited to such and such. And we feel happy and proud of that, because months ago, I guess was not the case.
Not as much.
We would have reached out to ministries, and we're trying to build that collaboration with them. And so by having persons with disabilities, attend such major discussions, you allow them to have that voice. Pertaining to anything that regards their living, their situation, as opposed to someone making a decision for you. And we're not here to say, here, do this, do that. We understand that you understand what you want. So the association knows what it wants. Addie's Place knows what it wants. Different bodies that work with persons with disabilities understand what they want. So by our department or our ministry lending that support to you guys in different ways, I feel like that's a way in which we help you to lead, because there are resources, not always monetary, but there are resources where that we might be able to provide to help you to get to that next step or achieve whatever goal for whatever event or program or whatever it is that you're having. And so by just us lending that support is what we're doing at this present moment. But any other specific policy or programs, not yet in place, but hopefully for 2025 and beyond, we'll continue to see how best we can listen carefully, because we know we have that close relationship with you guys and growing, thank God for that, and to see how best we can fulfill that need.
Because that would have been my follow-up question, but you just kind of addressed it. I was about to ask you if there was timelines for the implementation of these programs, but then you said they haven't have specific programs in place as yet. So I would ask, what role do you see organizations of persons with disabilities playing in shaping the policy system that should be coming on stream? What role do you think that not just the organizations of persons with disabilities, but people with disabilities themselves playing in shaping these policies and programs?
So just recently, well, not just recently, a few weeks ago, myself and our PS, we met and talked about what the ministry or what the department wishes to accomplish for next year. Every department has to do that. Every ministry has to do that. And so we put together a sketch of what we would like to achieve. But of course, we still leave it open, because we want to be able to hear from you guys. We want to be able to hear from even the CBR in Nevis. We want to hear from everybody to get an understanding of what it is that you want to achieve for next year, so that we can see how best we can collaborate. Because we don't want just one big error that we could make is try to put something in place and you have no care for it, or at least it's not a priority for you. So even though we have a sketch, and we did this, I think, in early 2023 when we first came on board. We tried to see where the association is, where Addis Place is, where different spectrum is, just to see what plans they had for the year, to see how we can fit in. And of course, we're still building, trying to see how we can build our outreach to persons in the community, because it's not everybody who has a disability is a part of the association or Addis Space and such. We know there are a lot of persons out there with a disability who are not in the light. And so we want to hear from persons, because the more we can hear from you, the better it will help for us to steer our direction in what policies or what programs will best help you, because we don't want to waste resources. We don't want to put something in place and it's not something that's going to be helpful to you, or it's not something that's a priority for you.
Okay. I guess that brings me to Miss Cranston, and I want to ask you, what steps do you think that families, educators or employers can do to help young people with disabilities reach their full potential? What do you think that they can do? What can the family do? What can the educators do? What can the employers do to help young people with disabilities reach that full potential?
I would say families can include persons with disabilities in daily life, let them have a opportunity to be included, let them have a voice to what they want, and also education, allow them to be included in schools, school initiatives, and the workplaces. I would like the general population to include a person with a disability. Let's work with a person with a disability and see how best you can help them. The first thing that I think that you should do is try and make your building accessible to include them in the workplace.
Okay, Miss Abby?
Yes, ma'am.
I want you to, you've been throughout the Caribbean, throughout the world, spreading the message about NDCs and the need for to be more active. So can you share any examples that you may have seen that you think that would work in St. Kitts, like health practices that could be adopted here in St. Kitts and Nevis?
Yeah, I think when we think about examples of good practice in terms of trying to get people living with disabilities healthier and happier, there are examples from across the world. Particularly, what I have liked is how organizations have gotten people active, persons who are living with disabilities, really active and fit. So things like doing chair-based exercises, really ensuring that gyms have been adapted so that people who are living with disabilities can take part in exercise and physical activity. There are examples and case studies from across the world, from Africa to the US, just around how, different programs have been introduced, programs on HIV and tackling HIV in persons living with disabilities, programs on non-communicable diseases and ensuring persons with disabilities have that information, it's accessible. Sometimes people have easy read leaflets, so they'll develop two types of leaflets, easy read leaflets, but they'll also develop other leaflets for the rest of the population. In the UK, when it comes to breast cancer screening, there's a whole process in terms of breast cancer screening for women who are living with disabilities. There's more time allocated. There's been training for healthcare professionals to assist with that. People are treated with dignity and respect. Make sure that women living with disabilities don't get left out of things like breast cancer screening. So there are a number of examples of how we can ensure that persons living with disabilities are incorporated into NCD, so that is non-communicable disease strategies and also health strategies. But I think for St. Kitts and Nevis, it's very important for us to maybe back up a little bit and do a little bit of research to try and understand what are the health challenges that people living with disabilities are facing in St. Kitts and Nevis.
So there need to be some dialogue.
So there needs to be some dialogue. We need to sit down and really truly understand how, and to quantify that. How many persons living with disabilities are having X condition, living with diabetes, or living with this, or living with that. So we need to quantify that and understand what the issue is. Then based on the resources that we have currently, how are we going to address those issues? And then once we've addressed those issues, then we can look at how could we become more creative and innovative in developing health programs for persons living with disabilities and trying to get in the funding to ensure that we can develop sustainable solutions to addressing the health challenges that persons living with disabilities face.
Okay, I like a lot of the things you say, but I have one little question. how do you see, how easy it would be to adapt some of those things to St. Kitts and Nevis? Like, we know we need to have a dialogue with the government, the different NGOs, people with disabilities themselves. And I think that's a lot of the times what's missing from that equation is the people with the disabilities and the organizations of persons with disabilities. And because we look at it and say, well, nothing about us without us, then we think that we should be included in whatever dialogue. So my question to you is, how do we get that conversation to the point where people with disability not just an afterthought in their own thing?
Yeah, I completely agree. So I think the good thing is you do have the Department of Disabilities who are very keen to have that conversation with persons living with disabilities. But I think really it is about meaningful engagement with persons living with disabilities. It's saying that, we're going to have inclusive planning. So right at the beginning, as we're developing healthcare services or any services, we're going to involve people living with disabilities right at the beginning, at the design stage of any program that we're going to implement. So whether it's a healthcare program, it's a poverty program, alleviation program, right at the beginning, we need to have persons with disabilities involved in the conversation. Not only that, but you need to have persons living with disabilities represented on committees and boards, and they need to be compensated for their time. So we need to ensure that they're at the highest level of the decision-making process, and that we don't just see them as a token. We're going to tick the box. Yes, we've engaged them. They need to be at the highest level of the decision-making process. And like I said again, and compensated for their time, because time is money. I think, like I was saying before, we do need to sort of empower persons that are living with disabilities. So I think we have a very good example on this panel already. If I am not misunderstood, Ms. Crannie, Cranston has been trained to deliver chronic disease self-management courses. So we need to empower persons living with disabilities to also be part of the solution. So to get out there, to advocate, to educate, and be involved in the process, and to work so that people are working with the people living with disabilities and not sort of giving handouts or feeling like they need to give a handout. We're working with you, we're working together, and we're trying to address a problem. So I think that would be, to me, how you would ensure that there's inclusivity and that we ensure that people are meaningfully engaged.
So, we have to go to another break. And when we come back, it seems like the government representative is also always after the break. So when we get back, we'll speak to Ms. Brown about some of the stuff that the government is doing.
This program is sponsored by SKNAPD.
I am 5'6".
I have natural hair.
I have brown eyes.
I am a Calypsonian.
I am a dancer.
I am a gold medal Special Olympian.
I love all things craft.
I am a graphics designer.
I am a motivational speaker.
But we can't put those skills to work for you
if we are not given the opportunity. If you don't have an open mind.
If you don't honor workplace diversity.
If you don't hire us.
If you don't realize that we work best together.
Together, we are differently able.
And it's what we can do.
It's what we can do.
It's what we can do that matters.
To support this cause, contact the St. Kitts and Nevis Associations of Persons with Disabilities at 465-2151.
It's time that we realize that we must work together to thrive. The world as we know it, the sky and below it. Could I never have more wonder? Yeah, with life and all you see and the climate's changing.
But hope is remaining.
And we can't ignore the future. It depends on you and me. One chance, all that we got. One voice, together we strive. Take care, the world where we live. Permite a todos vivir. Tomamos la oportunidad para guardar la humanidad. And I must leave no one behind because we are one.
Yes, we're back again, and we'll start with Ms. Brown. And I wanted to ask you if you could share any updates on the progress with the National Disability Policy. I know that there was some consultation, but can you share any updates on the progress and with the implementation of the UNCRPD?
Okay, all right. So with regards to that, so the consultant, she was here, this is December, so she was here back in, what was it, September, October? Time is really flying, right? And she did her consultations here in St. Kitts and also in Nevis. She had multiple meetings, and then just a few weeks ago, she submitted her report from her meetings. And so we would have taken that report and we submitted it to the different groups that work with persons with disabilities to be able to get their input, their feedback on her initial findings. And once we get that information back from different groups, then it goes back to her, and then she'll be able to continue doing what she has to do. So just to back it up, she's working on updating the disability policy and drafting the disability bill. And we look forward to that being all well said and done come 2025. Not sure when in 2025, but our hope is at least, of course, before the end of that. Just yesterday she would have met, I think it's yesterday she met with the Ministry of Sustainable Development because she wanted a little bit more insight into the National Development Planning Framework, as well as no, that was the Economic Development, Ministry of Economic Development. And with Sustainable Development, she wanted some insight into the revision of the building codes, because everything is disability. And so any policy or any revision of anything at all has to have that lens of disability in every single aspect. So I really appreciated the fact that she had that additional, or she requested that additional meetings with the two ministries, because she wants to make sure that nothing is overlooked in her report, so that come next year we have a very fine-tuned policy and draft bill.
Okay. And in terms of the UNCRPD, where are we in the implementation of the policy?
So that's one thing too. Of course, we hope to be reflected within the same policy and the draft bill. Of course, it doesn't mean we have to wait on those two forms of legislation to start implementing those things, because even when certain things are in place, sometimes things just the implementation of it still doesn't even work out how it should. But slowly but surely, in government programs, not just in our ministry, but other areas, we find that, for instance, what should I speak on? The CRPD speaks of many different things, from work to, of course, accessibility to healthcare, and not necessarily pointing out any specific things, but there are small achievements that you can see within society that we have been making. Is it slow? Yes, it's not as fast as we would like it to be, but when you look at the articles within the CRPD, you can find elements of certain things being represented or already being done here in our federation.
Yeah, you said it's not as fast as it should be. As a person with disability, and I'm sure Crannie will agree with me, that it really is not as fast as we would like it to be.
No.
Because the organization that both of us represent have been around from 1981. And we see baby steps, and we see some stuff that we as persons with disabilities think that should have been done already, but haven't been done as yet. So this question I would like everybody to answer. What do you guys think that to kind of speed up the process, how do you guys see government, private sector, organizations of persons with disabilities working together to kind of get some of these things on stream, speed up the process a little bit, so that, like the building codes, I was made to understand that Appendix F in the building codes is not optional, but it's mandatory. And it's just that nobody ever enforce it. So, like I told one of my cousins today, they keep building buildings and shutting us out of more and more of St. Kitts and Nevis. So if you shut us out of more and more of St. Kitts and Nevis, the problem is, I see, and you guys could, that if you build a sidewalk and don't put a ramp in it, chances of it ever getting a ramp in is slim to none. Because one thing public works wouldn't do that easy is go back and break up a sidewalk that they already fixed. So these things should happen in the beginning. So my question is, how do you see government, the private sector, people with disabilities and their organizations working together to expedite some of these things? And I'm going to start with you, Crannie.
Well, we are trying to be, we are asking to be included in some of these decision makings. For example, if you are building a building, why would you build a building and there is no ramp? Why would you build a building and there's no space for bathroom for persons with this a wheelchair? Why would you build a school without accessibility for a person with a disability in a wheelchair? How are we included if there's no accessibility?
I would agree with you, because I firmly believe, as a person with a disability, if you build a building and you don't put no ramps in it, you're literally telling me you don't want me to be there. At least that's how I look at it. Maybe I'm looking at it wrong, but I think that if the government or TDC or Flow has their office in TDC building downtown, and it don't have ramp access, and I think TDC need to fix it, because I literally go there and I have this thing in my mind that Flow moved from a place where they had a ramp to a place without a ramp, and that tells me that Flow don't want me in the building. I mean, I know that I'm maybe exaggerating a little bit, but I want to hear from Abby. What do you think? Like, how can we expedite stuff like that? Like, Flow is in a building, TDC owned the building. We know Flow can just go and put up some ramps, but it would be incumbent on TDC to ensure that because we have this is on the Flow network, right? So if I have a problem, I have to stand outside. I have to wait for somebody to come out there in the sun or the rain to get my problem solved. So what do you think that can or should be done to?
I think it requires a lot of work. So I'm not even sure there's a quick fix. So I think it requires a lot of work. So I would say that it really starts off with our federation-wide education and awareness around what are the issues. Everybody needs to be aware that we have 15% of the population living with disabilities, and we need to address the issue of inaccessibility. I think there needs to be a campaign that really educates everybody from the top down. All businesses, all sectors need to be educated. But also at the end of the day, I think it does require political will. We need a strategy to address all of these issues. To be honest, if you don't really have a strategy, there's no guideline, there's no direction as to where we're going to go and how we're going to get there and when. There's no deadline, there's no nothing. So it does need a strategy on how we're going to address the current issues, but then how are we going to address the issues moving forward. So I do think education, developing a strategy, and then to implement that strategy, you're going to need everybody at the table. So you're going to need some kind of cross-sectorial group or committee that includes every stakeholder. Everybody needs to buy in. And we need to once and for all say that we're committed to making St. Kitts and Nevis a more accessible place.
And Ms. Brown?
I thought about two different things. I've noticed that, the walk was last week. Mm-hmm. And then there was a similar one held last year with the Society for the Blind, Experience My Pain. And during those events, we had, like, for instance, social media influencers like Shaq and Sister Cynthia and Pinocchio. They were all part of it. They came and they videoed and they participated. And, persons follow individuals of such religiously. And so once you get, I believe, once we continue to bring awareness of issues like this, and we have the right persons like those persons assisting in bringing the information to the wider federation, then you realize that a lot of persons, their eyes are going to open up. Just this past Friday when they had the walk, at the end we asked persons, what's your feedback on, some persons were blindfolded, and one gentleman, he said while he was blindfolded, he shed a tear because he realized that, man, I really can't do this. And another person said something similar, like it was eye-opening, pun intended, right? And so that's that. I believe once we get persons to be more aware of what's going on, then the persons above us have no choice but to make changes. And then another thing that the consultant, she suggested, is that perhaps certain places could have mobile offices. So this is in the short term, I think, talking about. So for instance, Flo or whoever, a lot of buildings are not accessible. A lot of buildings are not accessible at all. And but that doesn't mean you don't have business to do. So perhaps instead businesses can say, okay, on Tuesdays and Thursdays, we're going to meet at this particular community center or these particular community centers around St. Kitts, around Nevis.
So now that's why they come to us.
Yes, exactly. Okay. So they come to you. So if you want to go to the bank or you have to pay whatever bill on whatever day, the buildings are accessible, but that business is going to be at the Newtown Community Center on Tuesday from 9 to 12 p.m., then you can go there because the community centers, for the most part, are accessible with the wheelchair access. And so that's a short run fix that, to me, would work best for us because we do have too many buildings that are not accessible, and unless if we have some very willing persons to dish out the resources to put in an elevator or ramps, I believe that might be the option for now.
Can one of the options be like government giving incentives, maybe in terms of tax breaks and so, to businesses so that they would kind of make the necessary changes? To me, that would help to expedite stuff a little bit, because we give businesses tax break for all kind of reasons. Mm-hmm. So maybe that needs to be one of the reasons that we give businesses tax breaks. Like if you make the place accessible, then you get X, Y concessions.
Yeah.
At least that's kind of well.
I believe so. That's a good idea. I'm always an advocate. I always like that, but I'm always an advocate for. I don't always believe that the government should be the only solution to any problem. This is a wider thing. This involves every single body.
I don't think that the government should be the only solution, but I think the government have to lead from the front.
Exactly, I understand.
So because they make all the laws, they make the policies, they put Appendix F in the building codes, and nobody enforce it. Mm-hmm. So that's kind of how I look at it. If you're not going to enforce the things that you have on the books, then it's going to create major problems in the long run. And that's just my way of looking at it. You know, I would say private sector has a lot to do because young people with disabilities, like Crannie keeps saying the whole night, needs better education. They need to be part of all these training programs that goes on around the Federation, you know, into adulthood. And if you're not going to do it, then you need to support organizations like ours so that we can do it, you know. And I think that's where some of it has to start, because our organization does its best to try to train people. This place does their best to try to train people. But at the same time, you have young people who come out of Cotton Thomas, young people come out of the one in Cicely Brown in Nevis, and sometimes they don't get jobs as they come out. And this place can't take no more people. The program at McKnight can't take no more people. So what do we do with these people? And I'm open to suggestions.
Yeah, I think businesses have a lot of work to do in terms of trying to ensure that their workplace is truly diverse. And so I think businesses need to really try and see what they can do to open up and accommodate so that they can take in persons that are living with disabilities and ensure that they have a process to ensure that, you know, people living with disabilities can progress through companies. There are opportunities for them. We live in a digital age. People can work from home. There are lots of different ways that that things can be adapted to ensure that people who are living with disabilities have a good education. But not only do they have a good education, but they also have opportunities to take that education and apply it, and therefore thrive and rise through the ranks of any organization.
Because if we're discussing leadership and inclusion, like you said earlier, there have to be opportunities for leadership. And that, to me, that what you just said would provide those opportunities for leadership. Because if you train people the same way you train everybody else, then that knowledge, they need to be able to use that knowledge. So they need the opportunity to use that knowledge. They need to be able to get up and do something. I want to switch to something that, because St. Kitts sits in the Caribbean and we're like a hurricane-prone zone. I must thank Jah himself. We haven't had a major hurricane in a lot of years. But one of the things we, as an organization, like to point out is that NEMA need to do more to ensure that the people with disabilities, one, you know where they are, and you know what resources they need, right? So my question would be to each of you, what steps do you think NEMA can take to ensure that disaster preparedness includes persons with disabilities? You as a person, what steps do you think that NEMA can take, like XYZ, to ensure that disaster preparedness include us? Because we need to be included. So from each of you, I would like to find out what steps that you think that NEMA can take. I'll start with Ms. Brown.
So you started with this time. I remember last year, well, I don't know, honestly, I don't know what it is what all NEMA, what they do in terms of preparedness. But I do know last year we did some research. I was just Googling how, hurricane preparedness for persons with disabilities, and I came upon a weather radio. So for persons who are deaf or hard of hearing, the radio, it displays text. So, in the event that, a hurricane or whatever disaster is upon us, then they can use that. And for someone who, for instance, is blind or who is visually impaired, you can have whatever emergency supplies with Braille labels on top of them. And so I thought that's very unique. And of course, other forms of disabilities. So have emergency supplies that cater to specific disabilities. I don't know what they have in place. Maybe they do have something, but of course this is going to require them to know.
What would you suggest that they do differently?
Honestly, that's why I say I don't know what they do. So I can't even say do something differently. I don't even know if they're already doing it. You know what I mean?
Okay.
But of course, with what I just said, that would require them to have a good idea of how many persons are blind and vision impaired, how many persons are deaf or hard of hearing, how many persons use wheelchair, and where exactly they are in the what you call it? What they break them up into zones. Which zones they're in.
So data collection should be where we start.
Yes.
Crannie, what steps if you was consulting NEMA, what steps would you ask them to take to ensure that people with disabilities are included in the disaster preparedness?
Well, I would say, as a person with a disability that was able to participate in NEMA training, I would say make sure that each building that you're going to have a workshop in is accessible to a person with disability. I would also like you to include a person on your planning committee or on your lookout point for each person. So I would just like you to include us in every decision making. Nothing about us without us.
And Ms. Abby?
Okay, yes, I agree. I think with what all my fellow panelists have said. So I think it really boils down to when NEMA is developing all their plans, so we know there's a disaster management cycle, thinking about persons with disabilities when they're developing their plans, and not just necessarily thinking about them, but including them in the development of the disaster management process and all of their planning. I think, like persons have said, they need to be aware of all the people that are living with disabilities, what their disabilities are, what their challenges are, have a really good assessment of who might be most vulnerable during a disaster. Identify those persons who are living with disabilities that might be on their own. Make sure that there's somebody who maybe is responsible for them to ensure, like during the disaster, can we account for them? Do we know what's happening with them? So really making sure that we have someone who is responsible for each particularly vulnerable person that's living with a disability. I think we probably, if they don't have it already, but a clear sort of evacuation plan for persons that are living with disabilities. So, if they're living wherever, or if they're in a home or whatever it is, and they need to evacuate, there's a clear plan and an understanding of how that is going to look. As Ms. Cranston would have said, I think the emergency shelters, those that are not accessible, we need to start doing some work to make sure that they are accessible as well. So I think really it just involves as usual, having a good conversation with persons living with disabilities, understanding the needs of those that are living with disabilities during disaster, what might be their particular vulnerabilities, and having a plan to address all of those issues.
Okay. And I'm hoping that the people at NEMA would be watching so that they could listen to some of these suggestions and maybe take them on board, look at how you can get persons with disability directly engaged in the disaster preparedness for their community. And it boils down to data. If you do not know where the people are, it's hard to go out there and try to do all that stuff when the emergency is here. So we have to start from now, collecting that data. We know where the people are, we know what the type of disabilities they have, the resources that you would need to move a person in a wheelchair, somebody with mobility issues, is different to the resources you would need to move somebody who is blind or somebody who is deaf. So you have to, I think there's that conversation that needs to be had. It seems that we're running low on time. And so what I would like to do now is have each of you guys give a closing, just to wrap up the thing. And I'll start with Ms. Bowen again.
And see me here trying to think of what I'm going to say. You call me first. Honestly, I just want to encourage other ministries to join on board in, advocating for persons with disabilities. We have met with and we have built relationships with a number of them throughout this year, and I'm very thankful. The department is very thankful. The ministry is very thankful for the support, because whenever we asked for, earlier we had a collaboration meeting or workshop to see how we could partner and do an event or activity or something, and we really did get the support from ministries, and we thank God for that, and we thank you for that. But we need you to continue. And we had other groups, NGOs. For instance, we had the Lions Club, we had BPW. I'm very thankful for them, and we want to continue working with them, as well as other groups. And parents, I attended a meeting the other day, and I think it was for Cotton Thomas, and one of the teachers said that parents, you are your child's best advocate. And some things that come to our table, sometimes we talk about leading or having, putting persons with disabilities in a leadership position, but sometimes parents or guardians, they shy from that, they hold back from that, and so we don't want you to do that, because if we're trying to push persons, we want you to help push them as well. So we want to be all-inclusive, where everyone is advocating for persons with disabilities.
Abby, 1 minute.
1 minute. Okay, then. So I would just use my 1 minute to say, that there is a lot of progress that needs to be made, but I would just like to say, kudos to the Association of Persons with Disabilities, the Nevis CBR Advocates, Special Olympics, Cotton Thomas, all the organizations that are working to ensure that we have an inclusive society. Kudos to the Ministry of Youth Empowerment, Aging and Disabilities for the work that they're doing also to try and ensure we have an inclusive society. I think from our point of view, we're very concerned. We want to make sure that persons living with disabilities are able to achieve the best health possible. And really that requires us to have a concerted effort to develop a strategy around health for persons living with disabilities. And that includes ensuring that they have access to health insurance, access to all services, access to health information. And so we'll just be really keen to see that work being done, and we're happy to support in any way that we can to get that achieved.
Crannie, 1 minute.
In my closing remarks, I would like to implore the nation, let's come together and advocate for change on behalf of the St. Kitts Nevis Association of Persons with Disabilities. Let's get on board in supporting all persons with disabilities. Lend your support in any way that you can, and also be sure to encourage each person with disabilities to be included in everyday life activities.
Okay, I want to thank you guys for being here with me tonight and having this discussion. I want to also make sure that we thank SKNAPD, because we wouldn't be here without SKNAPD. So I want to thank SKNAPD for seeing the need to come on board and to help us to get this discussion done. But one thing, throughout these discussions, one thing stood out to me, and that was the need for collaboration. We need to work together across government, civil society, the private sector, community organizations. This way we can amplify the voice of people with disabilities. And that's what we need. We need to be able to amplify the voices of persons with disabilities, ensure persons with disabilities are at the forefront. So I want to ask the people out there looking to let's use what was discussed here tonight as a call to action. Let's not just, we have another panel discussion and yes, we hear from the people. He was nice and he was informative, but use it as a call to action. Let this be that first step that begins the long journey, right? So that would be my closing remark. We talk about leaving no one behind, so let's begin to ensure that nobody gets left behind. Thank you guys for tuning in. Thank you guys as a panel for being here. I really do appreciate it, you guys being here. And I'm hoping that we would have begin to start to make a difference in the Federation of St. Kitts and Nevis. Good night to you guys out there in TV land, whether you're logged on the internet. We are happy to have you, and we sure would like to get your feedback in terms of what was discussed here and how do you see yourself being able to help to further not just the discussion but the actions to get us to where we want to get. Because it's one thing that we sit down and speak, and we need that. We need to have that conversation. But at the end of the day, we need to put all the stuff that we talk about into action. So let tonight be a call to action. Thank you, guys.